54, the voice of truth, the official radio station of the Church of Christ or Iglesia ni Cristo.
Good morning, good evening, good afternoon, wherever you are right now. Thank you so much for tuning in to INCRadio New York, and I will be one of your hosts for today. Of course, you should know who I am by now. I'm Sister Mika Jamaas, and with me, dear host, is Sister Abby. Hi, Sister Abby. How are you doing?
Hello, Sister Mika. I am doing well on this lovely Saturday morning. It's actually warm for an October Saturday, so I'm actually.
I know, I love it. I love it, but it's not too warm, so it's a little cool, which is like I love the fall so much, and I love this kind of weather. So very excited. Not only the weather is exciting, right? Our topic today is also very exciting. So we or someone we know has been affected or afflicted by cancer, right? So, because October is Breast Cancer Awareness Month, today we are going to discuss not just, of course, breast cancer, but different types of cancer and the importance of early prevention, detection, and screenings. So, whether it's a mammogram, colonoscopy, or a quick discussion with your provider, these are parts of taking care of yourself. So, for those in our YouTube live chat, if you have any questions for our guests today, please make sure to list them there and we will try our best to answer them throughout our show. So, before we go on to our fun facts, maybe we should introduce our special guests for today. Sister Abby, can you introduce them for us?
Yes, so we have two special guests for this episode, and hopefully you will not get confused because they both have the same names. So let's introduce Brother Cliff Stirba and Brother Cliff Stirba. Hello, brothers. How are you doing?
Hi, yeah, we are. I'm Brother Cliff Sturba from the locale of Wyndham, and this is
Brother Cliff Sturba from the locale of Wyndham.
So we can save energy by addressing. Just use the same name. Yeah, whatever you guys need, we're here for you. Whatever questions you have about cancer, we'll try our best.
Yes. As a quick introduction, I know most of us know Brother Cliff, the younger one. Let's introduce the other Brother Cliff.
Okay, yeah. So, all right, you have to tell us about yourself.
Oh, me.
Tell your name, what makes you, why are you on the show, kind of like your history, your medical history.
Why am I here?
Yeah, did you just wander in? No, he's actually an infectious disease specialist. Also, do a lot of primary care, and I work with under.
No,
I do. We see patients together, and we got a lot of these cancer questions, and
all the time.
Yeah, all the time. So we're here for you.
All right, thank you for the quick introduction. But we'll ask, as what we did on our previous show, we'll do a couple of fun facts throughout the show, and if you know the answer, just type it in the chat, and then we'll get into our topic. So the first fun fact, or not really fun fact, but first trivia is, what is the most common type of cancer? Okay. No multiple choice.
Oh, we're not in the chat.
We'll see. Okay, so what is the most common type of cancer? Okay, so now we can get into our topic. So basic question, what is cancer?
Would you like the honors, or
you please go ahead?
Okay, all right. So, cancer is commonly defined as a cell that has abnormal growth and division, and it can happen basically anywhere in the body. And there are several factors that can inhibit that, cancer formation, or spur it on. Am I close to that? Is that
Reasonable, right?
that's the definition of cancer? It's stuff that's growing that should not be growing, like that.
I mean, part of yourself that's growing. It sort of came from yourself up, compared to like an infection, which is other cells from somewhere else growing in you. With cancer, it's your own cells have somehow gone awry. They're multiplying too much.
That's basically it.
Okay. So we have like a general idea about like what is cancer, and it can happen obviously wherever there's like cells or whatever on our body. But we can get cancer, but how can we prevent it? Like, what are some ways that we can prevent getting cancer?
So how can we prevent getting cancer? There's a lot of ways to prevent cancer. And it depends on the cancer that we're talking about. If we're talking about, for example, skin cancer, that it's applying sunblock,
Staying out of the sun.
staying out of the sun, getting in the shade. If we're talking other cancers, like colon cancer, it's to avoid eating red meats,
Right.
Avoid red meats.
Right. I mean, no one's too sure about colon cancer. That certainly seems to be part of the picture.
Avoiding lung cancer means we
Don't smoke.
don't smoke.
Don't
Stay out.
breathe would be better.
Well, we can't do that, but let's see here. Let's see other cancers.
I have a question. So for lung cancer, you know, the most common cause is typically smoking. How about environmental particles or environmental exposures? Do masks, like say also like, you know, secondhand smoking, like do masks kind of help prevent those toxins if we go out, like if we're exposed to like environmental stuff, like should we wear masks to kind of prevent our exposure that way?
Masks can masks help decrease lung cancers? If like you're in a smoking area and you wear a mask, would it help? Well, I do know that if we're working with something like, for example, asbestos, if you're working in the shipyards or the old buildings, and we'd like to get rid of asbestos, it was good at stopping fires, but it's once it gets into your lungs, you know, so that's bad. We don't like that. A big thing to avoid getting cancer from asbestos is to wear a mask. But one thing that greatly accelerates or increases the risk of forming cancer is if, you know, even if you're wearing a mask, but you're smoking like increases the risk like exponentially. So yeah, the less that you put in your lungs, that's, you know, not good old clean air, the better off, I guess, in general, you're going to be. So masks, I'm going to say, yes, it can help a little bit.
Okay. I know a lot of people are also doing at home, you know, DIY projects and like working with fumes and whatnot. Like, how should we protect ourselves if we're starting to do like projects that have like a chemical smell to it or particles?
Oh, okay, yeah, like painting, like you're varnishing indoors or something. Yeah,
Do it outdoors.
do it outdoors, right? Be
upwind.
be well ventilated. Don't do it during the winter time when you have all the windows closed, because you know, make sure it's a well ventilated area. I think it says that on most of the cans on the directions. Start in a well ventilated area.
Exactly.
And yeah, I think that's a big one. There's also air filters, among other things that you could try to do for that kind of stuff. Yeah.
All right. Do we have any answers for a question, Sister Mika? Not yet. So just a reminder, if you know the answer, what is the most common type of cancer? So you can use our helpful, I guess, search links if you would like. But yeah, so we discussed like things how we can prevent cancer, like wearing sunscreen, being conscious of what we put in our bodies and whatnot. Now we can get into the screening. So what are the, I guess, I don't want to say the top, but what screenings do people should consider as they get older?
There are gender specific screenings, and then there are in general specific screenings. So I guess in general, if you've smoked in the past, in the past, or quit, or it depends on how much you smoked or you've quit within the last 15 years, we recommend that for lung cancer screening, we do it's called a low dose CT scan. And then for women, we're also checking out uh, mammogram for breast cancer and pap smears for cervical cancer
in particular.
For mammograms, it starts. I think we start at 40 to 49. Yeah, and then from there,
But depends on family history.
depends on family history, and then 40 to 49, and I think 50 and up until, oh gosh, 60.
Well, what depends on your function. I mean, if you're in a nursing home, you're not going to do colonoscopy or screening. But if you're otherwise well, there's really no age limit when you stop.
And then cervical cancer. We start at, oh geez, we start screening for cervical cancer. If we haven't gotten the vaccines already,
Right.
we start screening for cervical cancers 21,
right,
21, I believe. And then I think it's a sort of a yearly thing that you discuss with your doctor, depending on.
Depends if you have HPV. If you have HPV, it's more often. If HPV don't have it, it's
less often. Colon cancer. We start screening everybody, men and women. In general, if you have no family history, we start screening at 45. And it depends on the type of test that you do, and it depends on what they find. But usually, I think it's every 5 to 10 years, depending.
Depends what they find.
Depends what they find. If they find stuff that's a little more aggressive, might call you in next year.
That's exactly right.
If they don't find anything that's really impressive, then they'll say, see you in 10.
10 years.
But if you had a family member, say a family member that had colon cancer at the age of 50, we like to start in you 10 years before that. So instead of starting at 45, if your father, say, had colon cancer at 50, we start at 40. And that's it. Let's see, what else are we doing here? Oh, prostate cancer. It's dependent upon clinic. In our clinic, we take a little bit of a conservative approach. There's blood tests you can do. And prostate cancer, I know it's a scary kind of sounding cancer, but it actually moves very slowly. So people usually will die of old age before then. And the treatments for prostate cancer can vary depending upon the technology. And getting, but if you have any anxiety or any questions, you're more than welcome to speak with your primary care about that. I think that's a great question to ask.
Well, sorry.
Sorry to interrupt, but we have answers for our first question. A couple of you got it right. So the most common type of cancer in general is breast cancer. So we have Jazz04, Sister Gemma Stirba, Sister Allison Vital, and Brother Carl Ojeda answered for breast cancer. So it's not only women, correct, that can get breast cancer. Men can also get breast cancer. Other than mammograms, you should also on your own do self-exams, correct? Like, so every so often, just check your body, right, to see if there's anything out of the ordinary. Even though you may think it's benign or it's just a bump, it's better, right, to be safe than sorry. So the biggest thing I guess we can take away is like, yes, we have all these tests. Obviously, talk to your healthcare provider if you have any questions or your risk factors, and they can help guide you how to navigate all these tests, because it can get overwhelming, right? All these like screenings and whatnot, and it can get very overwhelming. So obviously, always talk to your healthcare provider. They know your medical history. They know what are your risk factors depending on your history, self-history, past medical, family history, social history, and they can guide you through that. But if you have any questions about your body, obviously you can talk to your healthcare provider. We can now go to the second question. What is the leading cancer diagnosis in men? So what type of cancer is the leading cause in men? That's kind of awkward, but yes. Okay,
if you were listening, actually, one of our brother Clifford Sturbus mentioned it very recently, right before we got them off, actually. So, yes, what is the leading cancer diagnosis in men?
and we have a question for the Dr. Clifford Stirbas. How far have we gone with breast cancer treatment or management? I guess they're asking about like the advancement in treatments for breast cancer.
So they're wondering how far have we gotten in treating breast cancers? That's the question. I mean, we have the guidelines, the algorithms for it are very complex, and they can range from we start off with the mammogram, and we check to see if there's anything there. We check with family history, and we see what the risk is per patient. And then we have from there, if there's something that's seen, then they can do biopsies, all the way up to preventative mastectomies and things like that, all the way up. And then there's also chemo, radiation treatments, and there's a lot of stuff coming down the line. Hopefully, very targeted medical treatments for breast cancer. But really, it's prevention. It's the big one that really helps. The earlier that we can that we can get a medical intervention in that history of cancer, the earlier we can see it, the more options we have to work with in order to prevent it. That kind of goes in general for all cancers, but definitely for breast cancer.
Yes. In just, I guess, my experience with breast cancer, I used to work in general surgery. So I dealt with a lot of like mastectomies or breast cancer surgeries. And I know even from the 10 plus years I've been a PA or a physician assistant, the type of surgeries also has improved. We don't have to take out all the lymph nodes anymore, and the risk of swelling in your arms or whatnot is reduced because the treatments have advanced so much and they're more targeted. So we don't have to do as much of a radical or take out more than what we have to. So I think that's not only true for breast cancer, but it's also true for other types of cancer, that you can be more localized. You don't have to take everything because the medical treatments are so targeted now. I know, like, we're probably going to go off topic, but do you know the advancement in regards to like the targeted immunotherapies, I think, for cancer, where they take like your genetics and see how they can tailor chemotherapies specifically to your type of cancer? Can you kind of elaborate
Yeah,
on that?
we absolutely have that nowadays. We can basically tailor chemotherapy to specific, sometimes depending upon if we're ERB, BRCA, all those things. If we're actually can tailor them now, we've got some really great stuff in the line. And you're right, we don't have to go as far as the radical mastectomies anymore, but it still is dependent upon if the patient is proactive with working with the primary care about sort of checking these things out ahead of time. Because it is the earlier that we can screen for these things, and the earlier that we can spot this by screening surveillance, the better the more options you have.
Right.
Sounds good. So now back, like we talked about all like mammograms, colonoscopies, prostate cancer screenings. What other types of screenings and pap smears, and lung cancer? What are your thoughts, or can you explain about skin exams? Like, when should we get our skin exam? Because that's like our biggest organ, right, of our body, and it's always constantly exposed to all like the UV rays, the sun, and other elements. When should we get like skin exams?
So
I don't know if there's any consensus.
in our clinic, we recommend a one-time, for all new patients, we recommend, if they haven't already seen a dermatologist, we recommend a one-time that they stop into the dermatologist. And the dermatologist will check every inch of skin to make sure that there's nothing that looks suspicious or that needs to be investigated. Because what can happen is later on in life, the dermatologist will sort of have this history of, okay, this is what our body looked like 5 years ago. Now, when you're coming back in today, you've got a curious mark that you're wondering about. Now, the dermatologist will be able to check it out. How early we start with that, I don't know.
I would say, I don't know. I mean, it depends on how fair your skin is. Fairer skin, the more sun exposure, earlier.
The earlier, but also remember, if you have darker skin, usually skin cancers can be more aggressive as well. So checking yourself and preventing, things from getting out of hand is part of the screening process. Dermatology visit in the 20s, I think,
Sounds pretty early.
sounds pretty early, right? But yeah, there isn't really that much of a consensus out, but especially if you're the kind of person that might be out in the sun all the time. Maybe you're a truck driver, and you have one side of your body constantly in the window. You'd probably benefit from an earlier skin exam than someone who works
the left side,
right, just the left side. Yeah. You'd probably benefit from an earlier skin exam versus somebody who is working inside underground in a basement.
Yeah. So, I mean, we have power of cell phones. So if you see something on your skin, take a picture of it and show your doctor, and then you can track it through time. So if anything, the biggest thing with skin cancer is like if anything changes, you should get it checked out. We have a question. How important is genetics for breast cancer? What are the stats? If your mom or sister has breast cancer, what is the likelihood you will have breast cancer?
So the question is about breast cancer, and if you have a primary relative that has breast cancer, are you guaranteed to have breast cancer as well?
Of course not.
The answer is no, you're not guaranteed to have it.
But there are known reciprocal BRCAs, which are known to be familial. But generally, recent breast cancer cases happen before the age 45. And family history, one or more of those, plus ovarian cancer. Actually, even BRCA is also related to prostate cancer in men. So, but those genes are not that terribly common. So, what explains a small part of breast cancer.
So basically, if you have a family history of breast cancer, it's good to ask your primary care physician. I'd like to get this checked. Your OB-GYN, they would happy to set you up with something to get it checked. If you don't have a history of breast cancer, you should also be getting regularly checked. That's why we do screenings, because it's better to catch these things earlier than later. That's actually a really great question. If your parents had it, are you guaranteed to have it? The answer is no. But it doesn't mean that we can just ignore
it.
In general, we still have to actually check.
Okay. Another question from the audience. Sister Maricel says, sometimes we say we need to do our early check early for mammograms, but when the time comes, we get scared, or any type of screening. What are some ways that we can combat like our fear or anxiety over screenings?
Oh, well, yeah, fear of cancer screening is a really big one. I guess knowledge is power, and as physicians, we are the ones that we can't force you to do anything. We can't force a patient. We can't, as much as we want to, we can't force people to get screenings. But educating yourself, understanding that there's risks, and catching a cancer early are all really big. It's scary, yes. The cancer is a really scary thing. But just because you've been diagnosed with cancer, it does not mean that it's a death sentence. Having your mammogram, even though it feels scary, it's good to do it to know, because your doctor can say, listen, we found something that we want to look at a little bit closer, come back in a week, or there's nothing. You can take it easy, right? For the next amount of time. It would feel you'd have more peace in your life to know one way or the other, because that gives you a chance to act. And I think that's what scares people. It's that they're going to get a really bad diagnosis, and it's going to be something that's going to throw their life off. That's really not true. By knowing what to do, we can actively fix it. and go after it and do everything that we can in our power to help with it. It's better to know than to not know. And yeah, the peace of mind that comes with knowing what to do next, if there's anything that needs to be done, is really good, and it'll help our life in general. So yeah,
Yeah.
don't be afraid of it. Don't be afraid.
Don't be. I mean, the thing is, if we catch it early, if you catch the cancer early, it's easier to treat. You know, like sometimes if it's early enough, it can be cured because it's just local, it's just contained. But when you have to deal with cancer so advanced, it's more difficult to treat. I know that you mentioned that some myths are, cancer is a death sentence. It's not a death sentence. Obviously you work with your oncologist, and they can get treatments for you to make it more manageable and to a cure. What other myths that you would like to debunk that other than cancer is a death sentence? I think the one is like canned foods. Like I think the most one of this is like canned sugar. People try to avoid sugar in their diet. Can sugar feed the cancer or make cancer worse or cause cancer? I think, can you debunk that myth?
I think most cancers can metabolize sugar. That's true. Um, and avoiding sugar in general is probably good for you as a health thing, right? Because we know that people who are overweight and
Have more cancer.
Very
definitely. Breast cancer in particular.
Sugar itself won't feed a cancer, right? I mean, cancers, they get nutrients from our bodies, but avoiding sugar it's not going to feed the cancer. If anything, if we avoid sugar, it will decrease our risk of getting a cancer, because at the end of the day, the less weight that we have, right? Being overweight is associated with inflammation. Inflammation can ruin DNA, and if it ruins it in the right way, you can get cancer. So less sugar in general is good for you, but I don't think it really affects cancer. Like if you had cancer, all of a sudden you go on a no sugar diet and the cancer goes away. It doesn't work like that. But that's a great question. That's actually, we've gotten that before. But yeah, staying on a healthier, normal BMI, normal weight for your age and gender is the good way to avoid or a good way to decrease the risk of cancer.
But yet you can think of foods which are cancer causing, right? I mean, like I think of one that I think off the top of my head is peanuts, which are not properly dried, can develop a mold called, and the mold can produce aflatoxins, which are particularly potent carcinogen. So, that's, it's just, there are foods like that.
Yeah, red meats is another one that's associated, like we said, with
cooked. I mean, that brown char that tastes so good is probably not good for you.
It's also cancer, right? And other things that we put in our bodies, like smoking cigarettes. It's not necessarily a food. That definitely causes cancer. So yeah, what we put into our bodies, we should always be very careful about that kind of stuff. We should make sure that we're getting things that are clean, healthy, nutritious. And we should limit all of the stuff that can.
All the good stuff, you mean?
Yes.
Well, thank you, Brother Cliffs, for this scratch of a surface about cancer and cancer awareness. I know we could go on and on about this topic and discuss and whatnot, but it's that time. So before we go, any last takeaways and your greetings?
Takeaways. Last thing, I guess I would say is, if you're under 40. I guess you can try to live your life as healthy as possible, exercise, eat healthy, and be good, and take care of yourself. Stay away from the things that you know are bad, and say hi to your doctor every other year, maybe. That's about it. But once you're over 40, we start taking things a lot more seriously, because what we did in the first 4 decades, now we're looking forward to the next 4, 5, 6 decades. We're looking to make those happy and healthy. Those make a difference. What we do now makes a difference for this. So we can have a happy life and a good quality of life all at the same time if we take care of ourselves.
Sounds good.
And don't be afraid to ask questions at the doctors. Please don't. It's a good thing. We like questions. What do you have to say?
good. You're good.
Okay, we're good. All right. As far as
And
greetings,
greeting.
greetings. Hello to the family here and abroad. Hello to our brethren in Wyndham here and our brethren abroad. What else? Well, you want to say hi to anyone in particular?
We can
Oh,
say hi to Amelia. We hear her.
Yeah, and I think that's it from us. Thanks for
All right.
having me.
Thank you again to Brother Cliff and Brother Cliff for your informative talk about cancer awareness. And now we're going to go to our New York activities. So upcoming activities for our district is on October 20th. We have the Kadiwa and Binti special gathering and socialization at 6 p.m. at the following venues: Rockland, Bristol, and Rochester. Again, talk to your local CFO officers for further details about this activity. And later this month, on October 27th, we will have throughout the district a Care for Humanity and musical EVM. So for the New England region, it will be in Boston, and it will be the Breast Cancer More Than Pink Walk. For the New York City area, it'll be a park cleanup in Inwood Park. And for the upstate New York area, there'll be a rescue mission in Syracuse where they'll drop off resource packages to the local area. If you are interested in any of these activities, please talk with your local leadership, and they'll provide you with the information and the links that we can be informed and join these activities. Thank you once again.
Thank you so much. Yes, thank you. And then we'll go quickly to the hashtag challenge from last week. Number 3 is Forest Hills. Number 2 is Johnsonville. Number 1 is Cranston. Congratulations to the local congregations and extensions. Our top hashtaggers are number 3, Marty Borant. Number 2, Philip Souther. And number 1, Sister Maricel. Thank you so much for constantly supporting our hashtag challenge. Thank you. Thank you. We'll read really quickly some of our greetings from Brother Michael Mercado. Good morning po. Happy Saturday po. Proud to be from hashtag Wyndham. We have Roblyn Pacal. Happy and blessed birthday to Sister Irene Mendoza from LIC New York. Hello also to Sister Jennifer Trinidad from the local of Long Beach, Orange County, California. Hello also to Barrientos from INCRadio Orange County, California. And we have Patricia, Sister Patricia. Hello, brothers and sisters. GWS from Dangringa, Belize, Central America. We also have Sister Mafe Aniag from Bermuda. All right. Thank you so much, everyone, for tuning in. That is all for our show today. We'll get our brothers back for more medical topics because we know that this is so important and interesting. So once again, thank you so much for the church administration for allowing us to have a platform to talk about these topics. We'll see everyone again next week, Saturday at 11:30 a.m. Eastern Time, 11:30 p.m. Philippine Time.
And greetings to our beloved Executive Minister, Brother Eduardo V. Manalo, and to our Christian Family Organization Coordinator and Subsidy President, Brother Angelo Ranio Manalo, to our District Minister, Brother Sheridan Santos, our Assistant District Minister, Brother Neil Patrick Omelda, our CFO Advisor, Brother J.R. Resurrection. That brings us to the end of our show. Good morning, good afternoon, good evening, and good night.
Make sure you go for your screenings.